the Toronto Star. I'm Saba Eitizaz, and this matters.
Lying for hours on an ER floor in unbearable pain, waiting for medical care as his family watched helplessly. That was the harrowing experience of Richard Decker, a 79-year-old cancer patient, because there were no beds available in an overcrowded ER. His story reflects thousands of others similar. A recent report released by the Ontario Patient Ombudsman reveals thousands of complaints of poor patient care in hospitals and long-term care facilities. Kenyon Wallace joins us for this short edition of This Matters to explain. Hi, Kenyon.
Hi, Saba. Thanks for having me.
Kenyon, what is the report and why does it matter?
So the report is an annual report from Ontario's Patient Ombudsman. And the Patient Ombudsman was created back in 2016 to basically hear complaints and concerns from the public about public hospitals, long-term care homes, home care, and most recently, community surgical and diagnostic centers, which are mainly privately owned clinics that perform things like colonoscopies, x-rays, sleep studies, cataract surgeries, that kind of thing. And what makes this year's report interesting is that the Patient Ombudsman's Office received 4,429 complaints. This is for the 2023-24 fiscal year. I should be clear about that. And that is the most complaints that office has received in its history. And basically, it highlights, I think what is fair to say, serious issues with Ontario's healthcare system and those concerns that the public has, particularly around hospitals and emergency departments. And I think why it matters is it reflects real life experiences because the people complaining are the patients and their families.
How does his experience reflect the bigger issues that have been flagged in the report? What are some of the findings that are striking to you?
Yeah, some of the main findings are that people were complaining a lot about how they were treated in hospitals. So some of the complaints revolved around things like a lack of compassion or perceived lack of compassion on the part of the patient and their families, poor communication, and long wait times, particularly in emergency departments. Some of the concerns involved people feeling dismissed when they raised their concerns with hospital staff. And interestingly, this year, there was a 30% increase in formal written complaints to the Patient Ombudsman. A lot of the complaints that the Ombudsman's office gets are like on the phone. But the fact that more people took time to actually sit down and write out their complaints, the Ombudsman told us that shows that there was a level of complexity, perhaps, to a lot of these complaints that warranted a more detailed explanation of why people felt that they weren't getting the service that they deserved. And more than half of the complaints about hospitals were about quality of care, sensitivity, and respect. So that seems to be a trend or a pattern within hospitals that at least perceived by patients. There were other concerns as well in the report, things like the treatment of patients in obstetrics and gynecology, as well as how people were treated in emergency departments when they had mental health emergencies.
Why are ERs such a problem?
So emergency departments have been struggling with overcrowding for many years now. A recent story that my colleague Megan Ogilvie and I did looked at their performance over the last 13 years. And what we found was that in the last 3 years in particular, wait times in the 90th percentile were higher than they ever were before. And I think one of the main issues here is when patients show up to the emergency department and they need to be admitted to hospital, there simply aren't enough beds upstream. What I mean by upstream is like inside the hospital in the wards to accept patients because they're already full. So those patients who show up at the ED, they basically end up staying there and taking up those beds, which should be there for people who are coming in from ambulances and on their own who need a bed and need emergency care. But that's not happening because there's so many patients farther upstream in the hospital who can't leave. That's a combination of the fact that a lot of them have very complex medical conditions and there aren't enough spaces in long-term care homes or home care to discharge these patients. So everything gets backed up from sort of higher up within the hospital. And so that has been going on now for many years. And I think there's just so many patients now who have these complex medical issues that it's now reached sort of like a tipping point where there's just such a huge backup in emergency departments that these delays are just happening way more often than they used to.
What needs to change?
So we've spoken to numerous medical professionals about this question, and the general sentiment is, number one, more funding. So that means more provincial funding for more beds within hospitals so that patients who do need to be admitted from emergency departments have a place to go within the hospital. More funding for long-term care spaces, more funding for home care spaces so that patients who are well enough to be discharged from hospital, but maybe not well enough to live on their own, have a place to go outside of the hospital. There needs to be more beds in the emergency departments themselves so that when people need to stay, maybe not for a long period of time, but for a day or two, that there are enough beds within emergency departments. Another concern we've heard from doctors and nurses in particular is that because of the pandemic and burnout, which is a real problem, a lot of people have left the profession or have left working in the emergency departments. So there's staff shortages that need to be addressed as well to handle the volume of patients that are showing up. So that's just one of the many concerns that we've heard in the last few years.
Thank you for your time, Kenyon.
My pleasure. Thanks for having me.
That was Star reporter Kenyon Wallace. I'm Saba Eitizaz. For more on this story by Kenyon Wallace and Megan Ogilvie, go to thestar.com and do subscribe and support our journalism. And of course, continue listening to This Matters wherever you get your podcasts. Thank you for listening. Let's talk again soon.